The other one we talked about was hepatitis D. Interestingly, hepatitis D is not a full virus, it's a half virus. It cannot exist without hepatitis B. So to remember, we always say that B before D, or you have to have Beth before D. It comes together, so once somebody has hepatitis B, that person can be infected with a D, or one can be infected with both hepatitis B and D at the same time. But if you don't have hepatitis B, hepatitis D cannot stay. So most of the things that we said about hepatitis B remains true for hepatitis D as well. Hepatitis E, this will cause acute infection. So what we've been saying so far is that hepatitis A and E will cause acute infection. Hepatitis B and C will cause both acute and chronic infections. Hepatitis D requires the presence of hepatitis B to be able to establish in somebody. Now, hepatitis E is also fecal-oral. What I mean by fecal-oral is taking food that is contaminated with hepatitis E. And hepatitis E is usually secreted in the feces of a patient who has the E virus. Usually, patients may present with weakness and occasionally have jaundice. Now, hepatitis E becomes important when we are talking about pregnancy. If you acquire hepatitis E during pregnancy, it can lead to very severe infections. So, for the viral hepatitis, in conclusion, I will say, we're saying that hepatitis comes from two words. Hepa meaning liver, itis meaning inflammation. So when you have hepatitis, it means inflammation of the liver. And something should inflame the liver. And we said this time we talked about the viruses. There are different types of viruses that can lead to hepatitis. We said hepatitis A, B, C, D, and E. Hepatitis A and E will give only acute infections. Hepatitis B and C will give chronic infections. We also said that hepatitis D is a defective virus or a partial virus and cannot exist on its own. It only exists where there's already hepatitis B infection. We said that now A and E will cause acute infections and they don't need any form of treatment. What we do is symptoms. So if you present with pain, we manage you with some painkillers, give you IV fluids or intravenous fluids, and then we ask you to rest. The body is able to recover itself, except in few patients who may have what we call fulminant hepatitis. Now with hepatitis B and C, we see these viruses can cause both acute and chronic infections. And they are acquired through mother-to-child transmission, or what we call vertical transmission. They can also be acquired through horizontal transmission. They can also be acquired through IV drug use, and then rarely through sexual intercourse. And we are saying that in the acute forms of the disease, we usually will just manage the symptoms. When it comes to hepatitis B, not every patient with chronic hepatitis B require treatment. Those who require treatment are those whose liver function test, specifically the alanine transaminase or the ALT levels are high, associated with high levels of the virus, or ultrasound showing fibrosis or cirrhosis. These patients will require antiviral treatment. The rest may need to be followed up to see if the defense system is doing the job well. And most people will not require the use of drugs in managing the patients. Then, what happens is that all that we are doing in terms of treatment is to prevent future complications. But note that hepatitis B is preventable through the use of vaccination. So if you are not vaccinated or you don't know your hepatitis B status, I admonish you to go and do the test. And if you are negative, go for the vaccine. If you are positive, seek treatment and you will be managed. Thank you very much.